In India, the prevalence of severe sepsis is 28.3% in ICU, and the mortality rate due to sepsis is up to 80%. As we know, sepsis is a complex disease which involves infection and stems the inflammatory response of the body. While a lot of options are available for treating infection, treatment of inflammation in sepsis remains a challenge. In the past, multiple immune system treatment modalities were developed to deal with sepsis inflammation, but none of them showed satisfactory results. However, in a recent study conducted by the scientists of Cadila Pharmaceuticals, a promising immunotherapy treatment for sepsis has been discovered. Presenting the first-in-the-world innovation by Cadila Pharmaceuticals, which will revolutionize sepsis management. Introducing Sepsivac. Save more lives. During sepsis, TLR4 receptors present on the surface of macrophages identify LPS in the cell wall of gram-negative bacteria and bind with it. Binding of LPS with TLR4 leads to the activation of a series of events in the cells, ultimately leading to the production of various inflammatory cytokines. This also leads to activation of the coagulation cascade, resulting in the production of thrombin, activation of platelets, and formation of platelet fibrin clots. Increased TNF-alpha and IL-1 beta levels are responsible for the release of tissue plasminogen activators from vascular endothelial cells, which contributes to coagulation. The process of inflammation also leads to production of nitric oxide, which is associated with hypotension and altered function of various organs. Sepsivac contains Mycobacterium W, an immunomodulator which is a non-pathogenic mycobacterium. Mycobacterium W is a poly-TLR antagonist and an inhibitor of various circulating cytokines. It blocks TLR4 and prevents the attachment of LPS to TLR4 and thereby inhibiting the production of various inflammatory cytokines. In a gene expression study, it was shown that the genes that are modulated in sepsis get reverse modulated by MW stimulation. As a result of the immunomodulator effect, Sepsivac effectively saves more lives in sepsis. This is substantiated by randomized double-blind controlled trial on 202 severe sepsis patients, which showed 11% of reduction in mortality. 0.1 ml of Sepsivac given intradermally at 3 different sites consecutively for 3 days reduces the days on ventilator, ICU stay, hospital stay, incidences of secondary infection, days on vasopressor, and improves the SOFA score. Sepsivac of Cadila Pharmaceuticals helps in saving more lives by reducing mortality and preventing complications in sepsis.